Hello, I'm Dr. Benjamin Dover with more timely pandemic tips from the Centers for Unease Control. What the hell just happened has received literally almost a dozen questions about how to manage life since my colleague Dr. Nicki Minaj put out her anti-vax swollen testicle tweets. This alarmed even my twin sons Rolled and Trip. So today, let me address the most pressing issues that you posed. One viewer wondered if you really needed to get the vaccine and wear a mask in public since most other people have already taken these steps. What about herd immunity, he asks. Yes, you do need to get the shot and wear the mask. Otherwise, you'll cause us all to learn a lot more Greek letters like delta, lambda, and mu. You don't want that on your conscience, do you? Also, let me remind you that seatbelts for cars were at first only optional, then became mandatory, and finally, they made it so your car would go beep, 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 unless you put them on. Don't make us fit you with a distance sensing beeper on your ankle, okay? Get the shot. As to herd immunity, that only works with an actual herd of animals, most of which do not utilize air travel. The eradication of human disease comes through all humans getting immunized. Notice that nobody gets polio anymore? That's why, vaccinations. Unfortunately, you can't be immunized from believing misinformation. We received another question asking how safe it is for young children to return to school. Of course, that depends. Even though I was immunized for measles, mumps, and rubella, I still suffered terrible bullying from Biff Robertson for much of my early school years. So there's always a risk in attending elementary school. However, today's schools have been budgeted for social distancing, HEPA air filtration, and open classroom ventilations. Plus, the kids don't seem at all bothered by masking. As of now, most teachers have been vaccinated so that they will not pose a health risk to their students. My advice to parents of young kids is to visit the schools, see how it's set up, talk to the teachers, and listen for that beep, beep, beep of an ankle monitor. We also got several inquiries about booster shots. Who needs them? When will they be available? Can't we just sit in a booster chair instead? The term booster is something of a misnomer. In fact, a third vaccination is exactly that. It's a simple process which can further immunize you for many more months to come. As of now, it'll be available to people over 65 and those with immune system compromises. But if you insist, we can get you a booster seat for your chair when you receive your third shot. Many of you have asked about this whole hand washing thing. Is it still necessary? It may have been a while since you visited the restroom in a restaurant, but you might remember the sign about employees having to wash their hands. Try to think of yourself as an employee of your community's health. If you can continue to wash your hands as directed, you will not lose your job as a healthy person. If not, you will be on the unemployment line at the pearly gates. Some are wondering about the treatment known as monoclonal antibodies. What is it? When would you need it? Monoclonal antibody treatments specifically targets the COVID-19 virus and fools your body into sending your own antibodies to fight the virus before it begins to replicate inside you. You would take this treatment only if you inexplicably have been avoiding being vaccinated, not wearing a mask in public, not maintaining social distancing towards others, and even though you're not from Florida or Texas. In other words, if you've already shown poor judgment about your health, this will be the last inconvenience you suffer before going to the hospital to get a tube shoved down your throat just to breathe. Getting infected with the COVID-19 Delta variant is very likely, unless you follow the guidelines we've laid out at the Centers for Unease Control. So do your part in eradicating this dangerous threat. Vax, wash, masks, and distance. From all of us at What the Hell Just Happened, I'm Dr. Ben Dover, wishing you good health. Bye for now.